Hello everyone, my name is Dr. Liz Dalgleish. I'm a naturopathic doctor and an associate at Georgian Bay Integrative Medicine. I work primarily in practice with women who are busy and ambitious and need help navigating their hormonal health concerns. So I see lots of patients with PCOS, PMS, fibroids, endometriosis, and women going through menopause and perimenopause. So today I'm going to be talking to you guys all about stress and what that looks like in the human body in today's society. So historically, when we talked about stress, we understood it in a very clear-cut, simple way. And it was basically summarized like this. So if we are exposed to a particular stressor, for example, like a bear, our body has a very distinct internal reaction to that perceived stressor that could potentially hurt us or put us in danger. So our body goes through a response called the fight or flight response in preparation for dealing with this bear. So you can see a different changes to our physiology. For example, we'll increase our heart rate to help move blood around our body to facilitate nutrient delivery and waste removal. We'll see an increase in our ability to perspire and an increase in our breathing rate to help bring in the oxygen into our body and deliver it to our muscles, which will contract more in order to run away from or fight this bear. And all of these responses are governed by part of our nervous system called the sympathetic nervous system, which is basically sympathetic to our plight. I like to talk about patients, talk about this way to patients. So it's helping us deal with this very stressful stimulus of the bear that could potentially eat us or hurt us. So naturally, when that stimulus is gone, when that bear is dealt with in whatever way we deal with it, our body goes through a second distinct phase that's essentially a recuperation phase or a rest and digest phase that allows us to restore our body after dealing with this stressful external situation. And so in the rest and digest phase, another portion of your nervous system is in control. So it's called your parasympathetic nervous system, and it's responsible for increasing your ability to digest food. It promotes relaxation and proper sleep. It's also a restorative phase that allows you to fight infection more, and ultimately it's the opposite of the fight or flight response. So in modern society, we are no longer dealing with the typical bear that we perceived in historically as a stressor. Our stressors in modern society are more chronic in nature, and we tend to have multiple of them at once. And naturally, as we are dealing with different types of stress that are more chronic in nature, our bodies have a different set of responses to this stress. And for different people, chronic stress, manifests in different ways. So the symptoms that appear in a person's health picture can be very varied depending on who they are and what they're exposed to, and a variety of factors, including genetics, different nutrition, health habits, abilities to cope with stress. It's very multifactorial, and as a result, people might not be aware of what stress in the modern day society looks like in their body. So for the rest of this video, I'm going to be talking about common symptoms that I see in patients who are dealing with chronic stress, and these symptoms are manifestations of managing chronic stress. So one of the common ways stress can manifest in the body is through changes to sleep. So your sleep quality is often disrupted if you're going through a stressful situation in your life. So for example, you could struggle with falling to sleep because you have racing thoughts throughout your mind. You could struggle with staying asleep if you wake up multiple times throughout the night from nightmares, or you're just simply unable to remain asleep. Another thing that can manifest is just feeling like you've had an unrefreshed sleep the next day. So you wake up feeling groggy and kind of headache. Could have headaches or brain fog, and you just don't feel like the sleep that you got really restored you. So sleep can be super affected by stress, and these are some of the things you should look out for if you experience them in a chronic nature. Another aspect of your health that can be affected by stress is changes to digestion. So we now know in the research, there's lots out there in the scientific literature that it says that stress can affect your digestion as well because of the link between your nervous system and your gut. So if you experience periodic changes to your digestion, so you experience chronic constipation or acute episodes of diarrhea, and you are going through a very stressful period in your life, for example, dealing with issues at your workplace, a deadline, a project that you have to meet, dealing with a stressful boss or coworkers that aren't collaborating with you. These are all things that could affect your digestion and ultimately impact your health. Another aspect of your health that could be affected by stress is unintentional changes to weight. So weight is obviously a complex issue, and stress isn't the only thing that can affect changes to weight. But if you experience a more stressful situation and you have changes to your appetite, which could either be increased, as people often stress eat, that's a common way people cope with stress, or potentially if you lose your appetite completely and result in a loss of weight. Both of those situations could be caused because of a stressful situation you're going through. So it's always good to notice if you've had changes to weight that you have not intended, because that could be correlated with stressful situations in your life. So another big part of health that can be affected by stress is mood or your mental health. So if you're someone who has a pre-existing diagnosis like anxiety, depression, or are experiencing an acute anxiety phase or a depressive phase, that could be triggered due to stress in your life. So it's always a good thing to notice if you're experiencing changes in your behavior. So if you feel more sad, anxious, and it's been persisting for several weeks on end at least, always consult a healthcare practitioner, because it could be the stress could be affecting your mental health, and it's good to address it head on and try to get the support you need in order to feel better. Another aspect of your health that could be affected by stress is your hormonal health. So for example, your period, if you're a woman, your period could be affected if you are undergoing a lot of stress in your life. So if you have a period that's fairly regular in nature, but all of a sudden it stops completely, or you experience changes to your cycle in terms of the length of it. So if you go from having like a period that's normally 28 days, but then it jumps to 35 or drops to maybe 25 days, that's something that you should bring up with your healthcare practitioner, as it's common but not necessarily normal. And one of the things that can help manage the changes to your period is stress management. Stress can also affect your ability to fight infection. So a lot of my patients, if they go through a chronically stressful period, like for example, moving or planning a wedding, getting divorced, they can experience more colds or flus as a result. And this could be a cause of some of the stress that they've been experiencing, manifesting in their ability to fight infection. Because if they're not in that rest and digest phase enough, they're not going through the restorative rebalancing that your body will need in order to help prevent getting sick. Finally, the last way I'm going to talk about how stress manifests in the body is through pain. So your ability to perceive and manage painful stimuli is diminished or mismanaged when you are under a lot of stress. So you could experience more pain, or potentially also reduce your tolerance to pain, or you could experience changes to your chronic health condition. So for example, if you have a condition like fibromyalgia, which is a pain condition, a chronic pain condition, it could be exacerbated by stressful stimuli, and you could have a relapse in that health condition. So thank you so much for listening to this module on stress and what it looks like in the human body in today's modern society. If you have any questions, I'd be more than happy to answer them for you in the weekly lives we do, or feel free to contact me through social media. You can find me on Instagram at dr.liz.nd. And you can also reach me through Georgian Bay Integrative Medicine's contact information. Thanks so much, and I will see you guys next week.